Thank you. You're welcome to our EDA on reinforcement learning. This is Emmanuel together with Chagaba on reinforcement learning and quantum optimization for low field magnetic resonance imaging. So, acute kidney injury is a situation which disrupts the renal oxygen, leading to severe complications if it's not detected early. And traditional imaging methods lack the time capability and making it difficult to track kidney function dynamically. And so understanding this oxygen distribution in the kidneys is very crucial for us to be able to detect AKI. I think for the rest of the discussion, I'll refer to acute kidney injury as AKI. And this data set, or the data set that we have, captures the relationship or captures PO2 variations in kidney and urine under different conditions. The overall goal of our study is to correlate the image findings with the dataset trends for improved AKI diagnosis and treatment. Kindly proceed to the next slide. Just an overview of our dataset. Some of the key variables we have are kidney PO2, which is basically the direct renal oxygen levels measured using the EPR imaging. Then we also do have oxygen levels in urine. We do have different rates of oxygen, like different rates such as normal, hypoxia, pneumoxia, and then we do have historical data, which is in relation to the different patients. And then finally, we do have the different treatment stages: pre-treatment, that is before treatment, and after treatment, which is clearly shown there. And then, of course, we do have historical damage severity to tell us if the kidney was mildly damaged, moderate, severe, and so forth. And so here we do have a distribution, just a histogram showing distribution of renal oxygen in the kidney. And we can see it's quite almost normal distribution with a mean kidney oxygen distribution, I could say, of about 37.8. Yes, 37.8 around here. You can observe from the histogram here. And this was our first analysis just to see distribution of some of our key features. Kindly proceed to the next slide. This is just a description of what was in the previous one, and then the distribution of our urine oxygen levels is also quite normal, not very abnormal, but the data set at least confirms, or this distribution confirms to us that oxygen levels in the urine are fluctuating in response to the treatment, in response to the acute KAI. And I think, let me allow my colleague to come in as well.
Yes, thank you very much for that. So as we continue, we shall start from here. Yeah. So if you look at the box plot, you see as you explain, trying to just explore the key features as contained to our data set. So in the box plot, just tries to compare the kidney PO2 levels under different conditions. The standards are normal and hypoxia. And so this one just shows us before treatment how the levels and after treatment. So sorry, this is the one. So we noticed that the hypoxia increases PO2 levels, while the hypoxia increases kidney PO2 levels, while the hypoxia, okay, this is a hypoxia, then this is a hypoxia. So this one increases the kidney PO2 levels, while the other one reduces it. So, and we yeah. So if you try to compare you realize that. So you realize that this one's appearance before this one has this is appearance, and when you this is like a box plot, and we are trying to compare the treatment at day 0 and after treatment, that's after 30 days. So at day 0, this one of the kidney, then this is after treatment. So at day 30, the levels return to the baseline and aligning to our histological findings, and this matches the results in our in our uh, in our in our in our attribute data set, aligning very well to the images as can be illustrated here. We also try to look at the distribution of the different conditions whereby the moderate, because you're going to train a machine learning model whereby the moderate have around 32 images, then the mild you have around 48, then the severely damaged, says that the damage levels of the different kidneys, so is around 21. And also during our analysis, we try to show the count. So this is like just an illustration of the count load. So 0 samples of the mild and the moderate. So we also just try to visualize and see after 30 days how it should look like. So the key takeaways from this is that the kidney oxygen distribution aligns with renal oxygen distribution, aligns with the MRI and imaging results, and also oxygen conditions significantly impact renal oxygenation, confirming image trends, and also the urine is unreliable as a biomarker for kidney oxygenation after injury, and reinforcement learning models can be trained on these oxygenation patterns, better diagnostics, and also to help the health workers be able to analyze the images better, and also be able to give treatment remedies quickly. Yeah, thank you very much.